And I'm just thinking about employer size groups, right? Where it's like, again, the 50 to 60% that don't use the plan at all, and the 5 to 10% that are spending 80% of those claims dollars. If we project that out over the entire population of the U.S., yeah, there's a lot of people that are spending a ton of money. That a small group of people that are spending a ton of money on the healthcare system and that type of thing. And so it becomes a bit staggering when you start to think about it like that. Like, okay, out of 330 million people or whatever it is, even if that 5 to 10% number, that's a big number of people. What's the saying about eating an elephant one bite at a time, right? That's the way you do it. If we can do this slowly with just a small amount of people, it can have such a big impact on the rest of us. And the problem is, again, in the fee for service kind of system that we've been in, all these old patterns of behavior, the incentives are on getting in and getting more visits, getting more referrals, getting more scripts filled, getting all these things. And it goes back to what I talk about a lot with the medical loss ratios and all that. And it's like, well, healthcare costs continue to rise, and that's partly why health insurance premiums continue to rise as well. But the dirty secret is that the insurance companies want to spend more and more and more on claims each year, because that's ultimately how they can grow their piece of the pie. Is if there's more being spent on claims, well, then that also inflates the amount of money that they're able to keep and get around that medical loss ratio of 80%, which was something that was codified in the regulation when the ACA was passed.